The healthcare professionals at Washington Hospital in Washington, Pennsylvania have fully integrated Vocera, a wireless communication system, into their day-to-day care of patients, and for the first time, with patients' families.
To be honest with you, when the hospital first introduced Vocera, I never used it. I didn't believe in it. I thought it was going to, I had a cell phone, I have a beeper, and I'm thinking adding one more piece of technology on my scrubs wasn't a good idea. But then I watched the operating room staff using it, I watched the labor and delivery staff using it, and I noticed it was much easier to get a hold of them. There are a lot of medical errors occur because of communication, and this has made communication much easier for me.
Sarah?
Call Ruth Cryle.
Can you talk to
Dr. Chef?
Yes.
I'm about to go into the operating room. Do you need anything right now?
No, we're good.
Okay.
If you need anything, just call me on my Vocera.
Okay, thank you.
We were spending somewhere between 2 to 3 minutes just for a 30-second, 40-second phone call to allow care to continue or to meet the needs of the patients.
Pre-Vocera, we were averaging about 4,000 overhead pages a month, and there was approximately 2,000 beeper pages a month.
Can you talk to Kelly Buzinski?
Yes.
Post-Vocera, we did another study, and those 4,000 pages went down to about 500 pages a month, and the 2,000 beeper pages are down to probably a couple hundred a month.
I use it to communicate to my staff members. I use it to communicate with other peers that I have when I need to speak to them immediately.
Go ahead and do coronals on the pelvis also. So sagittals on the lumbar, coronals on the pelvis.
Conference calls to broadcast to my staff.
We have approximately 2,200 employees. Of those 2,200 employees, we have 1,600 that are Vocera wearers. Anyone with patient contact and involved in patient care, we install the Vocera with them.
We have 3 people mainly that have to respond to help turn over our room, to prepare it and clean it for the next case.
Broadcast to OR turnover.
At the end of our case, we broadcast to OR turnover. It enables all 3 people to get the message immediately.
This is April in room 6. We need turned over for another case.
And it also enables them, using the functions of the Vocera, to speak right back to us.
We'll be right in as soon as we get this set put together.
More than just using it in the hospital among the employees, what I like best about it is the family use.
The nurses, when we take the patient back to the operating room, they call the family and let them know we're taking them back. And then when they get back, once we're starting, they let them know, and they also let them know when they're going to the recovery room.
I just want to let you know that Dawn's in the recovery room and the doctor will be out to talk to you.
Sometimes our procedures can, start out being a half-hour procedure, but can be a 2-hour procedure, so we theoretically are going to restrict the movement of the patient's family for that whole period.
They never knew what was going on with their patients, and now they are just sold on these. Everybody comes back and says, what a wonderful gadget this is. We just love it.
My name's Barb, and I'm taking care of your family member. I'm going to be bringing him back up to his room.
Well, this project has been a home run. It has one of those few technology projects that meets the expectations of administration, meets the expectations of the IS department, and also the users.
He did very well.
This is a yearly procedure with my husband, and we've always been afraid to go somewhere because if we miss the call, we're not available. These were handy because we could go anywhere in the hospital. It's a really nice thing to have. All the hospitals should use these.
Information I get from the staff, they're very happy. They give me the thumbs up. They don't know how they live without it. So it's been very quickly integrated into the workflow at this organization.